technical issues are always the kinks at the beginning.
Request to join, request to join, request to join,
I
request.
know. How are you? Thank you so much for being here today. I really appreciate you taking the time.
Good, thank you. I'm hiding in my toddler's room.
Awesome. I love the background. I love the background.
He's there. You'll probably like waltz on in here any given moment now, and
that's okay.
I got the dog. I got water.
So I was telling the audience, you are a registered dietitian. You have your master's degree. You're the CEO and founder of Essence Nutrition in Miami. But I want you to give us your version of yourself. And I'm actually curious, as your friend, to know why you decided to start Essence Nutrition.
So I was first a clinical dietitian at Jackson, which is where University of Miami trains its residents, and it's actually a level 1 trauma center. I'm sorry, it's like raining here and like the humidity, and like I just don't know what to do.
You're fine. You're fine. Ponytail always welcome. Yes, you're talking to the person who lives in scrubs, so it's okay.
I'm like a disaster. So I loved working there as an inpatient dietitian. I mostly worked in pediatrics, but I did a lot of adult cross training, and it was awesome. It was like Grey's Anatomy. You know, we did rounds. We were part of the clinical team. It was thrilling. I mostly worked with a lot of pediatric cancer and GI and transplant, serious stuff. But after a couple of years, I was like, you know what? I'm getting a little like cagey. I need to start something myself. And originally I wanted to go into product sales for like, you know, nutrition formulas. Of course, now everybody knows about Abbott formulas, but this was a million years ago. And those jobs didn't exist in Miami, and remote working wasn't a thing. So I was like, well, I guess it's start my own practice or become a professional dog walker. And my hair doesn't respond well to being outside. So the dog walker thing was a wash, and I started my own practice. And I loved it, but I got bored again because that keeps happening to me. And I started adding more dietitians to the team who also had clinical experience of at least 1 to 2 years. And now there's 8 of them, and most of them actually still have full-time jobs in their clinical settings to keep them real sharp. And they see our Essence Nutrition clients like after hours, but after hours for clinical dietitian is after 3 p.m. So it's the middle of the
okay.
I mean, you could have 40 jobs if you really wanted to. And then a couple of years ago, I took a step back from seeing private clients. I'm managing the team now, still reviewing all of their notes, strategizing with them. I still review every single client. I know, you know, every single hair on everybody's head that goes through the door. And I do more corporate wellness, school wellness, menu consulting, brand consulting. And then I have 2 kids.
I love that. So you are one busy lady. That's amazing. That's amazing. What you have been able to accomplish, I think, is really, really special because you bring, you know, I always tell people that in my world, in the fertility world, when you say doctor so-and-so, like everyone, you know, you kind of have that like blanket of legitimacy. But I think once you start talking about integrative practices like diet, you know, like nutrition, like acupuncture, like, I mean, any of these other complementary avenues, there it gets a lot more muddy in terms of who actually knows what they're talking about and who doesn't.
Yeah.
And so I really appreciate that you bring sort of this science-y medical hospital background to what you do. The nerd in me kind of appreciates and loves that. But also I think it gives a sense of comfort to the clients that are coming to you to know that there is sort of this background coming with that. So that said, we're going to jump right in, and I'm going to ask you a few of the most common questions that I get asked, and I have no idea because it is completely out of my scope of practice. So the first, probably most common question is there such thing as a fertility diet?
Right. Oh, and I forgot to mention, like, myself included, and you know this, obviously, plus like half the team, since we're all women, have gone through pregnancy, birth, miscarriages, IVF, IUIs, assisted reproductive technologies of all spectrums. So I would say that the fertility nutrition client is the fastest growing client, clientele base. So you're not alone. And we also have 2 psychotherapists on staff now. One who went through, you know, fertility things, one who is just is not lucky enough to have gone that road yet, but she's not looking to reproduce at the moment. So we brought them on because they have unique training in disordered eating, diet issues, anxiety, depression, trauma, and fertility nutrition support. So we, talk about scope of practice. Like, yes, you can say I've been there, but you can't really treat that well. And I'm all about relying on what I call the fusion of what does the data say? What did I learn? What do I know from my everyday practice, and what makes sense and what's best for you? And with mental health, that really, that really makes sense. So, okay.
So much overlap when you talk about depression, when you talk about trauma in the fertility space. Yeah. I definitely agree. I think that makes a ton of sense.
Yeah, and especially when it comes to nutrition, we see a lot of IBS and IBD and like all these gastroenterological disorders, and you just simply cannot address the food without addressing the mind, because there's something called the mind, body, gut axis, which is like a line, I'm doing this, that runs from your stomach. Not actually a line. It's a communicative process based on your microbiome and neurotransmitters that also reside in your gut. And, all of our clients have said, and me too, because I have IBS and IBD, when, this is good, this is good. So.
Yeah, I feel like a buzzword I've heard a lot lately is that gut-brain connection. So super interesting. And I love that you have that mental health support.
It'll be the ovary-brain connection, because if this is good, the outcomes here will be better. I don't know.
There you go. There you go. So let's talk about the fertility diet. Does it exist? If it does, what is it? I mean, let's explore that a little bit.
Okay, so remember my different like avenues and like my spokes of my wheel of healthcare decisions and how I make a decision for a client or a patient. I'm sure you do too. Data, right? Like research, rats, labs. No. I mean, you'll find stuff on the Mediterranean diet, but like where in the Mediterranean? Because like there's 38 countries there. So that doesn't help or make sense, and there's no concrete protocol. What makes sense, what I've seen, is normalizing hormones, right? And how do we kind of normalize hormones? Well, you don't do eating vegetables. You have to see your REI. Okay. And then to complement that, you also have to address the nutrition and the diet piece, right? So that means that perhaps there is a link between inflammatory foods and insulin, the whole like insulin metabolism thing and eating. But what that means for you versus me versus XYZ over here, we really can't address, in a general way. But in general, there is no fertility diet. It means getting sleep. It means moving. It means addressing mental health. It means normalizing weight to a point where it's not interfering with hormones in a negative way. And it means intaking every single group of food possible, obviously, not with any kind of allergy or, issue there, in a way that is really balanced and happy and comfortable for the individual.
I love that, because I think a lot of times there's so much pressure for patients who go through infertility. They have this sense of lack of control. And so I think the nutrition piece becomes almost this, well, this is what I can control. And so it becomes very restrictive, very limited, very like almost obsessive to a point. And then you have the opposite end of the spectrum, where we're so focused on the problem and the medical treatment and this and that, but we're not really addressing this, huge elephant in the room of either under or over nutrition or whatnot. So I love
optimal hormone and ovarian functioning and the optimal cycle. You don't need overnutrition. You don't need undernutrition. Malnourished people have really, really serious, estrogen, progesterone issues, right? Overnourished people have serious issues with hormones. So if we can maybe meet in the middle and come to a point where we at least eliminate that as a variable, and you get to eat and have fun, because eating is like not a really medical thing. It's something that everyone has to do and that you can seek pleasure from, then perhaps we will find the sweet spot where we're like, okay, it's not the food, it's not the diet. Maybe it's something that Dr. Swallow figures out, because it's not the food.
Right. So I want to, you mentioned inflammatory foods, and I want to shift gears a little bit and ask you about that, because a lot of my patients, specifically with endometriosis, come to me asking about an anti-inflammatory diet, inflammatory food. What does that look like? Can you just explain that a little bit more for the audience?
Right. So the anti-inflammatory diet posits that there are foods that contribute to something called inflammation and foods that prohibit the formation of inflammation. What is inflammation? If I slap this area, it becomes red, right, and inflamed. That process is not exactly what happens internally, but at a cellular level, which remember, your cells are what affect every process in your body, including the hormone cycle, the menstrual cycle, the fertility and everything cycle. Cells at that level can undergo inflammation from what are called ROS, reactive oxygen species. This does not really matter for you. What matters is there is a thinking that there are certain foods that can prohibit inflammation, contribute to inflammation, right? The problem is it's not so black and white because food doesn't exist in a bubble. So it's not like, okay, I ate a turkey, deli meat, which is known to be inflammatory. It's on that list over here. You're not going to like all of a sudden develop autoimmune diseases or acne or infertility, right? Like that that if then does not work in the world of nutrition. It's not like that. However, it might stand to reason, and this is kind of where I like to sink my boots, is that perhaps we should not eat inflammatory foods all the live long day, all the live long week, right? There's wisdom in there that we can extrapolate into ourselves without becoming nuts. So nuts are anti-inflammatory. So if we the food lists of what's pro-inflammatory, that would be trans fats, which are hydrogenated oils found in processed foods. That would be massive amounts of sugar. That would be artificial sweeteners, which I am just like not a fan of. That would be white and refined starches like white bread, white rice, white bagels, but that's not to say that I don't eat a bagel every week of my life. You know, deli meats, shiny meats, bacon, processed meats, charred at very high temperatures that produce what are called advanced glycation end products. These are basically, alcohol, you know, that would be like the pro-inflammatory food list, right? But again, this is a person who had a $19 cocktail last night, which I hate myself for, but also love myself for. This is a person who eats bagels, you know, but this is also a person who lives over here in the anti-inflammatory world, eating Asian mushrooms like shiitake, eating copious amounts of fruits and vegetables, lots of plant foods, lots of nuts and seeds, lots of nut and seed butters that my son has allergies, so I eat them outside the house. Lots of hummus last night because he's allergic to sesame. Very expensive hummus. Lots of tea. Coffee because it's a plant, but not so much that it moves into the territory of here. Alcohol, but not so much that it moves into the territory of 4 drinks at a time, which is not healthy. I had 1. Plus, cost is prohibitive. So if we maybe can eat mostly over here, if you're imagining a big tree full of fruits and vegetables and fish and seafood and nuts and seeds and Asian mushrooms and water, and fermented foods, which we can go into later, and maybe not so many of here, perhaps the inflammation that's taking place at this very microcellular level that might affect fertility and outcomes, we really can't say if then directly. That makes sense to me. Plus, as a dietitian, like, how can I ever get in trouble being like, eat more plants?
Sure. Sure. Now, I have had patients, you know, who will pull like specific foods. Like if you eat a bunch of asparagus, or if you, I don't know, there's some mixes with like citrus or whatnot, somehow that's better. Like there's not like any
not weird. You know,
there's not one particular food that you would advocate for, right?
I can't, like, it's like advocating for a favorite child or dog. Like I can't do that. I love all the children and all of the dogs. You know, like so the thing is, what will skew knowledge is, you know, someone, the Blueberry Association will say, okay, we're going to fund a blueberry study, and then all this wonderful thing come out about blueberries, but the Asparagus Association just doesn't have the money to fund studies, so you don't know anything about asparagus, but they actually have so many wild benefits also. What's cool about plants, known to you as vegetables, fruits, seeds, nuts, tea, beans, is that every plant has a value. It's called a phytochemical. Phyto meaning plant, chemical being chemical. Like a vitamin is a phytochemical. Vitamin C, antioxidants are phytochemicals. There's thousands of them. We don't even know about all of them, but every plant has like its shining, you know, talent, right? So the more varied plants you eat, the more phytochemicals you access. But that's not the only thing good about food. Non-plant foods have really beneficial stuff also that you need to eat.
Okay, super interesting. I'm loving this. And then you talk about sort of everything in moderation, which I love about you. Do you have thresholds, or do you have limits on like what you would tell? I mean, you mentioned alcohol, you mentioned caffeine, but what about, you know, like the pastelito, or, you know, here on the West, like our ice cream and all that? What Like
ice cream is only on the West Coast. So those limits only come from like big rich organizations that make limits, right? And that's based on years of research and testing in labs and data. And honestly, those recommendations change every 5 years. So I'm not saying throw them out. It's important to limit caffeine and alcohol in many circumstances, but you know, moderation is moderation, and it's uncomfortable because we cannot put a label on it. I can't tell you that 2 pastelitos is good and 3 is bad. I can't tell you that ice cream twice a week is good and 3 times a week is bad. This is why we lean on something, you know, in our practice called intuitive eating, where we learn the information and then you make the call. So if you don't have a pastelito every 3 days and that causes you to become obsessive and upset, and that contributes to anxiety, and that contributes to GI distress, and then you can't sleep, and then you start to diet, and then you start to have dysbiosis
spiral,
right? Just eat the damn pastelito twice a week. Like it's not a you know, big deal. Right. But if you're eating it every single day and leaning on that pastelito as an emotional crutch, that's something worth unpacking. So like I have to have these honest conversations with people that get really micro and like funny. It would be funny to be a fly on the wall. Like, okay, Carolina, you know, what's the food you can't live without? Okay, let's say it's pastelitos. Okay, how many times a week do you need to eat a pastelito? Well, realistically, I really only need it Sunday because I go to breakfast with my Argentinian family, and like I can't just like not eat a pastelito. I'll feel weird. Okay, great. So eat it on Sundays. Problem solved. And if you also want it on Wednesdays, it's okay, because I can't tell you that your egg retrieval is going to fail because you ate 3 pastelitos a week and not 2. I just can't. I can tell you that white flour, sugar, trans fats, and butter are not great for you, but I'd rather you eat it and be happy, and that relaxation and that happiness pervade onto your body in ways that I think are more salient than we actually know at this point than the inflammation from the pastelito.
Yeah, I love that. That's really helpful. And I want to touch upon something sort of in parallel, but shifting gears a little bit. I want to just touch upon certain diets that are really popular right now. Specifically, I want to talk about intermittent fasting, and I want to talk about the keto diet and how those play a role. And we're going to get to PCOS later, so I'm going to kind of like separate that out. But just fertility in general, you know, my patients who have unexplained infertility or endometriosis, or they're really just trying to optimize their natural fertility. What are your thoughts on those like specific kind of trendy ones that are happening right now?
Okay, I'm actually giving a presentation called Diet and Nutrition Mythbusters, when these are like 3 of my like pain points. So, okay, intermittent fasting. So, your body is fasted, and it's called the fasted state after 8 hours of no food. And that's why when we go for our egg retrievals, how long do we have to be MTO for? 8 hours, right?
Nothing after midnight usually.
Nothing, but your procedure's not going to start really realistically before 6, 7 a.m. So that is the time. Your body does need some time every day in every 24-hour cycle to repair and, you know, regenerate and get all its ducks in a row and, you know, do all these cellular things that contribute to better metabolism and blood sugar control and fight inflammation. The way it is kind of is like, if you're in your office all night, like right there, and you are not leaving, no one can come in and clean effectively because your culito is sitting there. Okay. So you need to get out 8 hours a night so the cleaning crew can come, but you don't need to get out for half the day. Okay. Because when you fast for half the day or more, you are imposing, number one, the benefits, you know, like it's not like, oh, you get even better glycemic control. You get even better metabolism. You get even better anti-inflammation. Americans have this thing like, if something is good, more is better. There's a threshold. So that said, you know, in rats, so over here, remember, I'm looking at my data and labs, intermittent fasting looks amazing. The mice are living very long, but are the mice happy? Are the mice able to go out on dates? Because no one wants to go on a date with you if you eat dinner at 3 p.m. Are the mice obsessed with food all day because they only can eat until 3 p.m. and then at 6 p.m. they're like, you know, losing their minds? Are the mice saying, you know, I was going to work out tonight, but like I can't because I don't have energy because I haven't eaten since 3 p.m. So like screw my workout? Are the mice having any respect to what they're eating, not when? So like intermittent fasting doesn't tell you what to eat. It just is like, eat whatever the heck you want. Eat all the turkey sandwiches and hot dogs and deli meats, you know, until 3 p.m. But then you're good and you're healthy, right? I think intermittent fasting works for weight loss. I hate because most people's demons come out at night and they don't eat all day. So because we just ignore our hunger signals all day, or we eat like little like mouse cositas all day. And then at 8 p.m. we order the entire menu. And then we drink all of the alcohol. And then we binge eat more of the snacks. And that, so I think it's the company that it keeps at nighttime that people think, oh, if I just stop eating at, by 5 p.m., I'm going to lose weight. Well, yeah, like what are you eating after 5 p.m.? I mean, so a lot of my breastfeeding clients, and I'm nursing right now, are like, oh, I gained all this weight. I'm so hungry. I'm eating all night. I'm like, I'm eating all night too, but I'm not eating 17 bowls of cereal. Like, I'm sitting here eating like yogurt and cottage cheese and peanut butter and, oats and stuff so it's not, I think intermittent fasting is an easy crutch for people to be like, I just want to lose weight. I just want to not like be all over the place. I'm just not going to eat, before X or X. And it really ignores the true issues with food that exist.
Got it. Now that said, is there a time, because like, for example, here in the US, we typically will do dinner. Now with my kids, it could be anywhere from 5 to 6 p.m. In Argentina, we typically ate a dinner around like 8, 9 p.m. was average. If you go to Spain, they love to eat super late, 10:30. So is there a time that's really like not good before bed? Or
like, if that were true, then everyone in Spain would die of a heart attack when they're 28, right? Because they not eat at 11 p.m. So what I believe the Spaniards do is they have hefty, nourishing snacks around 4 or 5 p.m. to get them till that 11 p.m. No one is going from 12 p.m. to 11 p.m. without food, unless you're a dog. No offense. There's no optimal time. It's when that works for you. So like, for example, if I had to eat dinner at 5 or 6 p.m., I would need a snack at 8 or 9 p.m. before I went to bed, because if not, I would wake up ravenous and overeat. So what I think happens to people is they try to go from 12 to 8 p.m. without eating, like, because they have like an 8 p.m. dinner time, and then they end up eating all of the snacks, and then they binge at 8 p.m. and they're like, it's obviously my 8 p.m. dinner, where it's like, why don't you just have a bowl of yogurt and some fruit and nuts at 4 or 5 p.m. if you're going to eat that late, and then you'll make a very sane and intuitive eating choice where you actually don't eat the entire basket of bread, and then you're good. It doesn't matter what time you eat. It does not.
I love that. That's so good though. I feel like you're dispelling like so many things, which is great. And what about keto? Briefly.
Oh, okay. So keto means ketosis, which is the reliance of the body and brain on fat and or protein in a 4-to-1 ratio, which most people don't know, for fuel. It is a last-ditch effort at saving the body. It is a form of starvation. Now, why do we even like know about it? Like, why is it a thing? Because the diet culture demons, which is people who think everyone should always be on a diet, stole it from kids with intractable seizure disorders, because there are some children and some seizure disorders, not even all of them, that when combined with a lot of medications and like these poor children and their poor families, when they go on a keto diet, which is not just eating no carbs, you have to like have a very, very, very acute understanding of mathematics and Excel. It has to be a 4-to-1 ratio of protein and fat to carbohydrate. It has to be at certain times. You have to do blood sugar tests all day. It is like not fun. I know the one person I know who has been able to successfully execute it is a woman who 2 of her immediate family members are doctors. She's very resourced and she has a doctorate herself. So it's like, it's a terrible thing. And unfortunately in those kids, it results in weight loss because they're starving, right? Not to mention it makes your liver look like an alcoholic's. It gives you high cholesterol. It can cause serious heart disease, constipation, and completely mess with your microbiome, which is the epicenter of your immunity and digestion, and probably has a lot to do with mental health as well. So why anyone would voluntarily do this is beyond my wildest dreams. Oh, I know, because everyone wants to lose weight and thinks that weight loss is the answer and is the be all end all for health and fertility. So then the diet culture people got a hold of it, totally bastardized it. They're not even doing it right. And they're just like, yeah, no carbs is great. And like, again, this is like, if little is good, more is better. Like, respect on the fact that it's not cool to eat 6 cups of white rice at one time if you have an insulin sensitivity and you are not an athlete, but like not respect on eating cauliflower rice and being like, it's rice and it's so much healthier, and me being thin means I'm healthy. So It is not something I ever recommend. I'm not a pediatric dietitian anymore, so I don't have people on keto because even I don't understand it anymore, even though I used to do it. But like, I would do it with the neurologist and the nurse and everybody checking each other's math. And I was like terrified beyond belief that I was going to be 1 gram of carbohydrate off and mess everything up and the kid would have a seizure. So does that answer your question about my keto?
I think we're pretty clear on where you stand on that. I want to shift to one more topic, and I promise I won't take too much more of your time, but one more topic, PCOS. So we are actually in PCOS Awareness Month, something that I see regularly, you know, in my office every day, if not almost every day. And it's a complex disease, even for providers, because there's so many different presentations, there's so many different phenotypes with it. But generally speaking, coming from your perspective, what are like some of the key tips or pearls that you would love to share with someone who has PCOS?
Right. So, and we have a lot of PCOS clients with and without fertility issues, just because they haven't tried to get pregnant yet, or they have, or so it's, you know, and like you said, it's confusing because the presentation is confusing, the data is confusing, and what to do about it is confusing. So again, the individual treatment has to apply to the symptomology, right? So you and I were discussing how there's non-insulin resistant PCOS, but something like my first pearl of myo and D-inositol would be helpful because of what you explained to me that I really can't even regurgitate here because I don't understand it. So number one is so here I am looking at my evidence, my big book of evidence, texting all my doctor friends at 3 a.m, and they're telling me inositol. And if you're interested in why, Dr. Solo can tell you. I'm just telling you that I've been prescribing it or not prescribing it because I don't have a prescription pad. Thank goodness. You know, like I've been recommending it off the bat, and it is just well known that it balances insulin and the hormonal cycle, even in the absence of an insulin sensitivity. Do you want to say why? Because like I can't.
Okay, so basically inositol, specifically myo-inositol and D-chiroinositol, are downstream messengers of the insulin receptor. And we know that the level of the ovary, we have IGF-1 receptors, which are basically insulin-like receptors. And so with long-term usage, what we have seen is that these downstream messengers actually improve. And it's a little bit more complex. It involves some enzymes called epimerase and FSH and whatnot. But basically, the long-term usage improves the hormonal milieu at the level of the ovary, even in women without insulin resistance. So for patients who have met criteria for PCOS, inositol is a great like first-line supplement to start. And usually the studies were a minimum of 12 weeks. So that's why as soon as the diagnosis, just start it and continue it. Yeah.
So here's why I like it, besides the fact that that was very convincing, is that the risk is zero. There's like no side effects, no interactions, nothing weird. And the benefit is potentially very strong on the hormonal milieu. Okay, so wonderful. Speaking of other supplements, we don't just blanket recommend vitamin D. We test a level and see if you're low, and we talk about food sources that might, you know, we always recommend food first and supplements second. So food sources of vitamin D would be things we were told you to eat otherwise. Plants like Asian mushrooms and egg yolks, which are not a plant but are very healthy, because choline is another nutrient that is very important in pregnancy, fertility, and the whole female health triad. And fish, wild fatty small fish like salmon, sardines, herring, mackerel, fish that people are usually weirdly like uncomfortable with, except for salmon. But start eating sardines, you'll thank me later. Not on a plane, maybe on a plane, who cares? Speaking of fish, omega-3 fatty acids are one of the bazillion nutrients known to be anti-inflammatory, but you don't just want to be taking omega-3 pills. They actually can affect blood flow and bleeding and things. We talk about food first, so we emphasize those small fatty fish once again in the intake. Again, with PCOS, other pearls of wisdom, PCOS pearls, addressing mental health and sleep, because there is a huge implication with PCOS, stress, anxiety, and this axis. And we can just start calling it the ovary brain axis, because I'm sure do. So PCOS is linked to inflammation. And if you're getting 6 hours, which is not enough, of sleep per night, you know, chronically, that does build an inflammatory like picture, especially for insulin. We know that people who are sleep deprived have insulin and blood sugar levels akin to diabetics sometimes, just from lack of sleep because of all the hormonal implications of sleep deprivation and the hunger hormones. Have you ever noticed when you don't sleep, you're just hungry all day? That's a hormone called ghrelin and a suppression of a hormone called leptin. So sleep and addressing mental health and stress is really important. This is important, number 2 or number 3. So everyone PCOS is like, oh my God, I have to lose weight. I have to exercise. I'm going to do HIIT classes 7 days a week because then I'll maximize my weight loss. And what we find with over exercising intensely is that it actually contributes to an inflammatory picture and can exhaust you and lead to sleep issues and lead to over hunger. So because these classes are so intense and wild, you kind of like overcompensate and overeat after, right? I'm not ignoring the physiological benefits of running 3 miles at a pace of like 3 minutes a mile. I'm not sure why anyone want to do that, but we like gentle exercise with PCOS, especially if you're not in a place where you're already conditioned to be doing HIIT classes, which I never will be, and that is fine. So gentle movement and movement that, you know, contributes to health, wellness, and, you know, dealing with any insulin issues and perhaps weight normalization, but not like I'm gonna run a triathlon every single day. Number 4 is understanding the role of carbohydrates and not being like, all right, my name is Monica and I love keto now. No, it's understanding the type, role, and place of carbohydrates. There are different types of carbohydrates. It doesn't mean good and bad. It means ones to usually include, ones to usually exclude. Bagels, pastelitos, not all day, every day, but have a place and time. Understanding how insulin and blood sugar works, which is that if you eat carbs, even if it's grapes, you know, a fruit, in the absence of protein and fat, you will have an insulin and dextrose picture that does this and does this. Okay. And you and I were actually talking about grapes for sleep, long story, which that if you are going to eat carbohydrates and you're insulin sensitive, it would be wise to pair them with a source of protein and fat. So not just eating grapes, but eating grapes with some yogurt or cottage cheese. Okay. And I think my last one in the realm of sugar was to avoid copious non-nutritive sweeteners. People think, okay, like stevia is fine. Here's the thing, data, I don't have like any literature on stevia and monk fruit. It's too new. No one's doing the studies. So I really, you know, there's nothing good, nothing bad, but that doesn't mean that it is fine to have 17 packets of stevia a day. We just don't know, right? We've done studies on other what are called artificial sweeteners because they're not sourced from plants. Just because something is a plant doesn't mean it's good. Cocaine is a plant, okay? So we know that a lot of Splenda and a lot of that, you know, these artificial sweeteners can potentially contribute to GI distress, dysbiosis. Again, it's not an if-then picture. My clinical recommendation to err on the side of caution is avoid all of them altogether if possible. My entire pregnancy, fertility, breastfeeding, I just don't play. Like why? The risk of avoiding them is 0 and the potential benefit of them is like 0, you know, so because you don't need them. You know, when you drink coffee or tea, the presence of milk and flavorings like vanilla gives it enough sweetness. If you ask me, cinnamon gives it sweetness. That said, if you have one stevia every, you know, 5 days, few days, like I don't know if no one knows. Okay. But I do know that 17 packets of anything a day is probably not a good idea.
Yeah. So I want to, so I am a big believer in a multidisciplinary approach when it comes to fertility treatment. And so not only working with the fertility specialist, but also working with other specialists in their scope. And I want to just touch upon why you think, well, I know why I think, but what does the data say in terms of working with a dietitian when you are on this journey?
Oh, I've sent you these articles. So do not play coy with me. There is I don't even know why we have to have the data. Like this is just me, like common sense that working with a dietitian during fertility treatment, even if it's not to have a baby, even if it's just a diagnosis of PCOS and or egg freezing or anything like that, is beneficial to the process. Why not? If you are eating more consciously and eating better, you are living more consciously and living better, baby or no baby, eggs or no eggs. So apparently we needed to fund studies to tell us that, but I believe it makes sense as well.
No, and I think the important thing to understand is like this piece is just as important as the medical treatment that you're going through. And so making it as much of a priority as the medical treatment that you're going through. So like when we talk about sleep, when we talk about proactively managing stress and mental health, like this is one more pillar of that. And I just feel, I can't stress enough to patients, because I know for a lot of people, either insurance doesn't cover it, or they think it's like, I don't have time for this, or I know what to do, I can figure it out. And I mean, it's well documented that having the accountability, having somebody who knows what they're doing, guide you through this is going to set you up for better success.
I mean, it just makes what I've been through, what I've seen clinically, what my friends have been through, the more, you know, cooks in the kitchen and heads in the huddle, the better the outcome and the better you feel, you know. So why not, you know, if possible, maintain and obtain all the spokes of this wheel, you know, physician, dietitian, mental health, acupuncture, you know, what therapy dog, whatever you are, you know, whatever you recommend.
Yeah.
None more. I mean, obviously you're the captain of the ship 100%. We cannot do it without you, but like, you know, it's everyone has merit and weight, and, you know, just the more support you have, the better.
I love that. I love that. Okay. So Monica, this has been amazing, and I'm so grateful to you. Tell me, where can people find you? And I don't know if they would work directly with you, because obviously you're now doing more corporate, but work with you and your team.
I'm in a nursery with a Mickey Mouse right now. So my Instagram is Eat Like Monica, obviously. You can probably find me there. All incomings go to hello@essencenutritionmiami.com. Our website is essencenutritionmiami.com. And, you know, we do virtual visits. We, you know, we don't just see women, we see men, children, you know, the whole fam. But thank you for having me. You are the reason for the season, and you, you know, save lives as a doctor and add lives as a doctor.
I appreciate that. Thank you so much. So guys,